If your shin hurts and you're still running on it, you need to watch this video before your next sessions. Because here's the thing, shin pain in runners almost always get written off as shin splints. You rest it for a week, maybe you foam roll, maybe you Google it, read something about ice and ibuprofen, and go back out. And sometimes that works, but sometimes it doesn't. And the reason it doesn't is that you had something else entirely. Something that looks almost identical to shin splints in the first few weeks. Something that if you keep running on it, can turn into a complete fracture. That thing is called a tibial stress fracture. And the single biggest problem I see in runners who end up in clinic with one is that they had all the warning signs weeks earlier and didn't know what they were looking at. Today I'm going to walk you through what shin splints actually are, what a stress fracture is, how they overlap and how they differ, and a specific test you can do right now to work out which one you're dealing with. Let's get started. What actually happened in the shin? Before we get to telling them apart, you need to understand what they are, because they are not two completely different things. They are actually part of the same continuum. Let me explain. When you run, your tibia, your shin bone, absorbs load. Every foot strike sends a wave of force up through your lower leg. Under normal circumstances, your muscles act as shock absorbers. They take the first hit. They protect the bone. But when training load increases too fast, or when the muscles fatigue, or when you are not sleeping well or feeling well enough, those muscles can't absorb load the way they should. And the bone starts taking more than usual. Stage 1. The bone response. When the bone absorbs more stress than it used to, it responds the same way muscle does. It remodels. The bone gets broken down and remodeled with new bone cells. This is normal and healthy. It's how bones get stronger over time. But it only works if the stress and recovery are balanced. When training load spikes and recovery doesn't keep up, the breakdown happens faster than the repair. The bones becomes temporarily weaker and more vulnerable. At this stage, the surrounding tissue, the periosteum, which is the outer layer of the bone, starts to become irritated and inflamed. This is what we call medial tibial stress syndrome, what most people call shin splints. The bone itself is still intact, but is under more stress than it can comfortably manage. Stage 3. The crack. If load continues to exceed recovery, the bone eventually fails. Not all at once, but incrementally. Tiny micro cracks form in the bone's cortex, its outer shell. That's a tibial stress fracture. Still a partial injury in most cases, but now you have actual structural damage in the bone. And here's why it matters. Shin splints, if managed properly, can heal within 3 to 6 weeks. A tibial stress fracture requires 6 to 12 weeks of no impact in a walking boot. And if you keep running on an undiagnosed fracture, those micro cracks can propagate. They can turn into a complete fracture. And now you need an orthopedic opinions. That's not me trying to scare you, that's just the biology of what happens when bone is loaded past the point of repair. So let's talk about how to tell them apart. Here's the honest truth about shin splints versus stress fracture. In early stages, they can feel almost identical. Pain in the shin, worse with running, better with rest. But there are specific patterns that separate the two. And once you know what to look for, it becomes much clearer. Pattern 1. Where exactly is the pain? This is the first thing I assess in the clinic. Run your thumb along the inner edge of your shin, the medial tibial border. With shin splints, the tenderness is diffuse. It aches when you press along a section of the shin, but there's no single spot that makes you flinch. With a stress fracture, it's different. The tenderness is focal. There's one specific point, usually no larger than an inch, where pressing reproduces sharp pain. You will know when you find it. That pinpoint tenderness is one of the most reliable clinical signs of a stress fracture. Pattern 2. How does the pain behave during a run? This is arguably the most important distinction. Shin splints have a warm-up effect. The pain is often worse at the start of the run, then as your tissues warm up and blood flow increases, it eases off. You might finish a run feeling almost fine. Then it returns the next morning or the day after. Stress fracture pain doesn't do that. It doesn't ease with warm-up. It worsens progressively as you keep running. and it often gets severe enough to make you stop mid-run. If you have ever had to cut a run short because of shin pain, not just discomfort, but the pain that forces you to stop, that might be a red flag. Pattern 3. Does it hurt outside of running? Shin splints are primarily a running problem. They might feel stiff in the morning after hard sessions, but walking around, going upstairs, going about your day is usually fine. A stretch fracture is different. Pain that persists when you are walking normally is a warning sign. Pain that comes on when you climb stairs, pain that's when you wake up in the morning, not from training but just from the weight of your foot. That's the bone tell you it's injured. Pattern 4. The hop test. This is a simple clinical test you can do at home. Stand on the affected leg, hop 10. With shin splints, this will be uncomfortable. But with stretch fracture, it will produce sharp focal pain at that specific point of your shin. Often, people can't complete the 10 hops. Well, it's not a definite diagnosis, but it's a very useful test for you. Now, people might be asking, can't I just get an x-ray to check? Here's the problem. In the first 2 to 3 weeks, x-ray missed roughly a third of tibial stretch fractures. The crack is too small, the bone appears normal. If you get an x-ray, it comes back clean, and you take that as a reassurance to keep running, you may be making a mistake. MRI is a gold standard. It can detect periosteal edema, the early bone stress changes, before a fracture has even formed. This is a section most runners skip, but it's the one that tells you why you developed this in the first place. And understanding that cause is what prevents it from happening again. Training errors, the biggest driver. A 2022 review confirmed that training errors account for roughly 50% of shin splint cases, and the pattern is almost always the same. Volume spikes. Runners increase their mileage too fast, or they add speed work before their body is ready, or they come back from a break and try to pick up where they left off. However, the bone doesn't adapt to load changes overnight. Surface and footwear. Concrete offers considerably less shock absorption than trails or grass. If you have recently moved your training to harder surfaces, your bone stress increases, even at the same mileage. Same applies to footwear. Worn-out shoes lose their cushioning before they look visually worn. If your shoes have over 500 miles on them, they may not be protecting you the way they should. Muscle fatigue. This one gets overlooked. Your calf complex, especially the soleus, is one of the primary shock absorbers for your tibia. When it fatigues, the bone takes more. Strength training for your calves isn't just about power, it's about bone protection. If you're not doing any calf loading work, you are leaving your tibia exposed. We'll come back to this. Bone health factors. This is particularly relevant for female runners, though it affects men too. Low energy availability, not eating enough relative to how much you are training, reduces bone density. So does disrupted menstrual function in women. So does low calcium and vitamin D. Stress fractures in runners who are underfueling are not uncommon. And if you have a stress fracture before, your risk of another one is significantly higher. Section 4. What to actually do. Right now, so now you have a clearer picture, let me give you a practical guidance. If you think it's a shin splint, you don't necessarily have to stop running entirely. Modified running is generally impossible, but with specific conditions. Pain should not exceed a 4 out of 10 during the run. Pain should return to your normal baseline within 24 hours of the session. There should be no focal point tenderness suggesting a fracture. If all 3 of those are true, you can continue running, but you need to reduce volume. Cut your mileage by about 50%. Avoid speed work and hills in the acute phase. Run on softer surface where possible, and gradually rebuild over 2 to 4 weeks as symptoms allow. If you think it's a stress fracture, stop running. I know that's hard to hear, but it's the only appropriate answer. Running on a tibial stress fracture risks progression. You need medical assessment, MRI if clinically indicated, and if confirmed, 6 to 8 weeks minimum of no impact, often in a walking boot. I'm not saying this to be dramatic, I'm saying this because the alternative is a complete fracture. And that takes considerably longer to recover from. You can use the time to work on upper body strength, pool running, cycling, anything that keeps you moving without impact. And address the contributing factors: load management, nutrition, footwear, strength. The calf loading program you need, whether it is the shin splints or stretch fractures in recovery, you need to strengthen the structures that protect your tibia. The research is clear on this. Start with double leg calf raises, standing on both feet, control slow through the range, 3 sets of 15 daily. Progress to single leg calf raises over 2 to 3 weeks, then add load, a rucksack, a dumbbell, or tolerator. The goal is to build a soleus that can absorb force efficiently, so your tibia doesn't have to. Let me bring this together. Shin splints and stretch fractures exist on the same continuum of bone stress. Shin splints are the earlier stage. The bone is under pressure, the surrounding tissue is irritated, but the structure is intact. A stretch fracture is what happens when the pressure continues without enough recovery and the bone develops micro cracks. The key differences are these: diffuse pain versus focal point tenderness, pain that eases with warm-up versus pain that worsens through a run, discomfort with running versus pain with walking and daily life, a negative hop test versus a positive one. If you are sitting here and those second descriptions sound more like you than the first, please don't keep running. Get it assessed by a professional. And remember, a negative x-ray is not a guarantee. Here's a bigger point I want you to take from this. These injuries almost never come from nowhere. They come from the load increasing faster than your body could adapt. That's not a failure of your body, that's just information. Your body was telling you it needed more time, through fatigue, through that diffuse shin ache. The runners who avoided these injuries are not tougher, they're just better at listening. That's a skill you can develop. Start by knowing the difference between a warning sign and a red flag. That's what today was about. If this helped, share it with a runner who's pushing through shin pain. They might thank you for it.